Okay, well, I think we will go ahead and get started. I see participants coming in, and we are ready to go here. So we will go ahead and launch our presentation. So first of all, let me welcome all of the attendees to this afternoon's first Roseman University State of the University address. I want to thank everybody that's attending for taking time out of your busy schedules to spend about an hour or so with us. I think we have a really great presentation for you. Academic year 2019-2020 marked the 20th anniversary of Roseman University. And we had several events throughout the academic year, culminating in today's event, which actually was supposed to be originally scheduled for April, but as I think, unless you're an alien, you realize that COVID intervened in that timeline, and so consequently we postponed this event until today. And as much as we'd like to be with you all in person today, unfortunately we're still in COVID mode, so to speak, and so we'll be doing obviously this over Zoom. Hopefully those of you who haven't had the opportunity to visit Roseman or are just learning more about Roseman today will take the opportunity to come visit us, particularly once you get to know more about us through today's State of the University event. I do have a few special thank yous. I want to acknowledge some special folks who are with us today. First of all, we have several elected officials and government officials that I want to recognize. We have Cassandra Munoz from Nevada Congresswoman Dina Titus's office. We have Driana Demachulak and Gabby Everett from Nevada Congressman Susie Lee's office. We have Nevada State Senator Dr. Joe Hardy, Nevada State Senator Marilyn Dondero-Loop, Utah State Representative Susan Pulsifer. From the Nevada Governor's Office of Economic Development, Vance Farrow is with us today, and from the City of South Jordan, Sunil Naidu. We also would like to take a second to recognize some of our academic colleagues who are with us today. We have the CEO of Touro University, Nevada, Shelley Berkeley. Also from Touro, Laura Yavitz. From our colleagues at Rocky Mountain University of Health Professions, we have Dr. Richard Nielsen, Cameron Martin, and Sandy Pennington. From Southern New Hampshire University, Kenneth Lee. From Western Governors University in Utah, Sherry Lowell. And from Milan Institute in Nevada, Christopher Moderson. We also have some partners and friends of the university with us today that I'd like to recognize. We have Brian Sinan from the South Jordan Chamber of Commerce, Sally Dobler from the Las Vegas Chamber of Commerce, Nathan Peterson from Intermountain Healthcare, Jeff Cooper from Reuben Brown, Rita Vaswani from Nevada State Bank, Danielle Sargent from the Vegas Golden Knights, Liz McMenamin from the Nevada Retail Association. And lastly, I'd like to recognize our current and previous board members who are with us today. We have David Dunn, who is the current chair of our Board of Trustees, Susie Cram, Annette Logan Parker, Harvey Reisberg, John Rich, Rick Smith, Carlene Walker, former board members Hugh Anderson and Mark C. Toller. Welcome to you all, and I want to also just shout out a special thank you. I saw on the RSVP list several Roseman alumni who are in attendance today, so appreciate that you're taking time out of your schedules to visit your alma mater here, at least virtually. And also currently all of our current faculty, staff, and students who are with us this afternoon. So again, we appreciate the time that you've taken out of your schedules to be with us for today's presentation. And without further ado, we will launch into it. So today we really have about four main areas that we're going to review. Since COVID interrupted us, I thought it would be interesting for you all to get a little more information on what what Roseman has done vis-a-vis COVID and how we've responded to it. Because it is our 20th anniversary year, we're going to take a look back at the 20 years of growth that Roseman has enjoyed here in Nevada and in Utah. And we will tee up our friends from Trip Umbach to talk about the economic impact that Roseman has had in our communities. And then finally, we'll close things out by looking at the future and talking a little bit more about our strategic plan. So without further ado, let's talk about our COVID response. So on March 13th is when really things started to be interesting with respect to closures in both states. And as a result, the administration and academic leaders met, and we initiated the closure of all Roseman campuses to students and non-essential employees starting March 17th. And within those 4 days, we really had an amazing transition. Most of our employees, the 501 employees in Henderson, Summerlin, and South Jordan, transitioned to work from home and continued to serve and educate our students. Over that short time frame, which was a weekend, I remember it quite vividly, we pivoted to distance learning. And I have a huge shout out to our IT folks who were able to transition us very effectively and efficiently to the point of, with that hard work and ingenuity, the collaboration across disciplines and within the university, and with tapping all the resources we already had in place, we transitioned to a classroom that looked like our regular classroom to what you see on the screen now. And I actually got to teach 3 days in our virtual environment via Zoom, which was an experience for me too. But what you see on the screen is what we experienced during that time frame. But the result is what's really important, and something that I'm really proud of, and proud of all the folks at Roseman who pulled together to make this happen. The result of that quick pivot and the ability to turn around in that time frame was no interruption in any student's learning, and for the students to be able to progress through their programs at the regular pace. Specifically, looking at each one of the colleges, each one of those colleges did a lot to make that happen. In our College of Nursing, they provided 784 curricular clinical hours using virtual simulation through the remainder of academic year 2019-2020 that ended on June 30th. They graduated 70 students who completed nearly a quarter of their curricula following campus closures, but those students graduated on time, and all current students remain on track for graduation on time. In our College of Pharmacy, we transitioned to full 6-hour days of virtual instruction in just 3 days. There were 0 classroom days missed as a result of that. Our College of Pharmacy faculty and administration creatively modified early and advanced experiential rotations, with a mix of those being virtual, telehealth, remote, and safe on-site rotations. Again, all class of 2020 students scheduled for graduation on May 14th prior to the pandemic remained on time for graduation, and all current students still remain on time for graduation. Our College of Dental Medicine, pretty amazing. They deployed a high flex model, delivering didactic both in person and online with the same faculty. They modified their simulation clinic to conform with pandemic guidelines and to allow students to maintain and enhance their hand skills. And they maintained continuous clinical presence for urgent and emergency patient care to protect vulnerable populations. While we had a majority of our students and our faculty and staff off campus, our facilities folks kicked into high gear, preparing us for what was to come with bringing people back on campus. And it was primarily the facility staff that brought in many of these safety measures that we are employing today. So you can see that we have social distancing in effect in all the common areas, as well as the classrooms and the library area. We provided all students with a thermometer, some hand sanitizers and masks so that they could be prepared when they walked into class. And our goal from the very beginning was to bring students back as much as possible on campus. And again, it's what these folks in facilities have done, and the flexibility and the creativity of our faculty and staff that really has made that possible. So since July, Roseman has welcomed new students to our programs, with most of our students attending class in person. And just as an update, as of today, looking at our COVID positive numbers based on both faculty, staff, and students, as of today, we've only had 14 positive students at our students and staff and faculty at our South Jordan campus, and only 7 positive at our Henderson campus. So in July, we were able to bring back new students with 111 new dental students, 166 new pharmacy students, and 168 new nursing students, joining the more than 1,000 returning students to Roseman campuses. On top of that, and again, something that I'm really proud of that we were able to accomplish during this pandemic and as we reopened, is we experienced 0 furloughs of employees and 0 layoffs. So everyone that was with Roseman, that wanted to stay with Roseman through the pandemic, could. We had no increase in tuition for our students this year. So from AY 1920 to AY 2021, no tuition increase for our students. We're also able to effect a cost of living raise for all employees, despite the challenges of COVID-19. And we had no delays for incoming classes. I will have to also, give a shout out to, and particularly because we have representatives of our congressional delegation here, a shout out to Congress for providing the CARES Act funding. The CARES Act funding did help to offset many of the expenditures that we incurred as a result of the pandemic. Not everything, but it was very, very helpful and much appreciated. I'm sure by other institutions, not just Roseman, but certainly by Roseman. So that is our COVID response. I'm going to transition now into a little bit of a history of Roseman, where we've been in the last 20 years, and celebrating where we've been in the last 20 years. So with that, we'll kick off our video.
With 20 years behind us and the future ahead of us, we see endless possibility. We started simply with the goal of raising the bar, expecting more, with the belief that healthcare education could be better, more effective, and more successful at producing highly competent, empathic healthcare professionals. We started with $15,000 and a dream. 20 years later, with over 6,500 graduates, millions of dollars of economic impact, thousands of patients treated, and innumerable lives changed, the future is a beacon burning bright. As our university has expanded, so has our mission.
Roseman University of Health Sciences advances the health and wellness of the communities we serve by educating current and future generation of health professionals.
Conducting research.
And providing compassionate patient care.
In our communities.
We actively pursue partnerships and affiliations that are aligned with our mission.
We work to create an environment which fosters both internal and external collaborations to achieve optimal outcomes.
And are committed to responsible fiscal management in all endeavors.
As we look ahead, we have so much yet to accomplish. We will continue to grow and expand our reach and support into the communities we serve. We look ahead to the next 20 years with you by our side. Thank you for being part of our journey. With you by our side, we are Roseman Strong.
Okay. So, celebrating 20 years of Roseman, and that video is exciting to me because you see how much we've grown and who we are. And for those of you that haven't had a chance to visit our campuses or any of our clinics, hopefully that gave you a feel, and hopefully it whets your appetite to come visit us and see more in person. So 20 years, what does that mean? Well, we were Henderson born in Henderson, Nevada in 1999. We are a private, not-for-profit higher educational institution incorporated in the state of Nevada. And I want to stop there for a second to make sure everybody understands what we mean when we say that we're private, not-for-profit. As a private higher education institution, we take no state taxpayer support. So there are no tax dollars allocated out of state budgets that come to support Roseman University. And that's important to know, and particularly as we start talking about the economic impact of Roseman University, there's really been no investment by taxpayers, yet we return so much to our communities, both in what we do, how we educate students, but also from a real economic impact. We're not for profit, which means that Roseman's revenues are used to support Roseman students and Roseman operations directly. We are not beholden to any shareholders to generate dividends. And then lastly, we operate on campuses located both in Nevada and Utah. We have a very diverse student body that we've grown over this last 20 years. We have students that come from over 43 states in the United States and 16 countries. This next slide shows what I think really distinguishes Roseman from every other university in the United States, and that's our Roseman 6-point mastery learning model. I won't take the time today to discuss this in any great detail, but basically, as an overview, what the 6-point mastery learning model is a restructuring and an reorganization of the way in which we educate and train healthcare professionals to support our students' attainment of a high level of competence and a mastery of knowledge, skills, and abilities needed for the demands of healthcare in 2020 and beyond. The next few slides we're going to show you depict how we have grown and the programs that we've added over the last 20 years. But you know, as the heading of this slide says, meeting community needs, that has really been the key to Roseman's success. That is that we've developed our new academic programs based on the healthcare workforce needs of the communities that we served. So we started in 2001 with our first class, which is a Doctor of Pharmacy class. It, at the time, was the only college of pharmacy in the state of Nevada, and actually still is the only pharmacy program in the state of Nevada. So there was tremendous need, and we developed this College of Pharmacy as a way to meet that need. 3 years later, we developed a Master of Business Administration, an MBA program specifically tailored to the health professions, because that happens to be an area that most healthcare professionals in their training in school don't get a lot of exposure to, yet when they go into practice, they are confronted by business and the business of healthcare from the very beginning. So the Master of Business Administration program in 2004 was designed as a value add for our pharmacy students and later on to our other programs as they evolved. In 2006, and again in response to what we heard from our clinical partners, there was a huge need for nursing. There still is a huge need for nurses. So in 2006, we developed the Bachelor of Science in Nursing degree, our BSN degree. And because we saw that need extending, the needs extending to our Utah community, in 2006, we started our PharmD program in our new South Jordan campus in Utah. In 2009, we began to work in the realm of dental education with an orthodontics residency program that combined the MBA program. And we started that orthodontics residency program here in 2009. The residency program was designed for individuals who had already attained their entry-level dental degree and wanted to get specialized training in orthodontics. 2010, our neighbors to the east of us here in Nevada called on us again and said we need nurses, and so we expanded our BSN program to our South Jordan campus. In 2010, we added a different learning paradigm to our Bachelor's of Science of Nursing degree to make an accelerated program that was our first hybrid program, where part of the program was delivered online and part of it in person. And then in 2011, we started the first Doctor of Dental Medicine program in the state of Utah. We were copied thereafter by the University of Utah, but we own the fact that we are the first College of Dental Medicine in this state. And then we expanded our ABSN program, the Accelerated Bachelor of Science in Nursing program, to Utah in 2015. Our most recent addition is a Master of Science in Nursing Family Nurse Practitioner program, which is online, and that launched this year. And you'll notice that we have the whole United States there because we truly are recruiting from all over the United States for this online program as existing nurses which wish to advance their skills to attain the master's degree, FNP degree. All right, some numbers. So currently, our student enrollment is approximately 1,600 students. That is in contrast to what we started with our very first PharmD class of 36 students. So in 20 years, we've started with 36 and progressed to having over 1,600 students enrolled at Roseman University. We have over 6,000 alumni. And another key statistic that I always like to point out is that our student loan default rate is and always has been less than 1% post-graduation. And that's an important statistic that I want to spend a little bit more time on because what it means in the grand scheme of things is that Roseman delivers on its promise to prepare our students to be successful in their chosen healthcare professions. It means that our students are employed and able to pay back their student loans in full and on time. And so I would, if you're interested in this statistic more, take a look at any other institutions out there, many other institutions out there, clearly not doing nearly as well as what Roseman is doing with the student loan default rate. And this statistic also deserves a shout out for Sally Michelson, our Director of Financial Aid, and her entire financial aid team that helped to prepare our students with their financial aid processing and how they pay back their loans post-graduation. So a statistic, as I said, that I'm very, very proud of for Roseman. So that's the academic side. And as we've built the academic side, we've also begun to meet our community needs on the clinical side. So in 2009, we started an orthodontic clinic at our campus in Henderson, Nevada. And for those of you that are interested, it provides high quality orthodontic care at a much reduced cost. And I can attest that my own daughter went through the clinic and her teeth are beautiful. So I know that it works. I can put my money wherever my mouth is. In 2012, as we started the dental program in Utah, we also started a dental clinic in South Jordan, Utah. Again, the dental clinic offers lower cost care, particularly serving the needs of the underserved in the northern Utah area. In 2018, and as an entree to our College of Medicine that you'll hear about later, we've also started the Roseman Medical Group practice at Spring Valley in Las Vegas. Again, great care. So if you're looking for a primary care physician, please check us out. And then in 2019, with the advent of our advanced education and general dentistry residency here in Henderson, we've started a dental clinic as well. And again, I can attest as a user of that clinic that they do a wonderful job. We also have been excited about the fact that we've brought Cure for the Kids into the Roseman family, Cure for the Kids into the Roseman family as an independent division of Roseman University of Health Sciences. For those of you that are unfamiliar with Cure for the Kids Cure for the Kids is Nevada's foremost pediatric hematology and oncology treatment and research facility. Cure for the Kids treats patients who otherwise might have to go out of state regardless of their ability to pay. Not only that, but they bring cutting-edge research and therapies to the children of Nevada with ongoing clinical trials. And they have several value-added specialized treatment programs in physical medicine, neuropsychology. They have a child life specialist, and they have all kinds of programs to support the entire family. Because they cure cancer every day at Cure for the Kids, they also have a long-term follow-up clinic for survivors of childhood cancer that may be experiencing difficulties as a result of the treatments that they've been through while they did have cancer as a child. And most recently, and I know that they're all very proud of it, and we're very proud of them, they opened the Andre Agassi Foundation for Education's Learning Center so that kids that are undergoing cancer treatment get support to make sure that their academic activities don't suffer as a result of the fact that they're being treated for cancer. So Cure for the Kids is a very important component and division of Roseman University that we're extremely proud of. Just to kind of also give you a sense of growth from an economic perspective within Roseman, we started with $15,000 in 1999. The three co-founders, Harry Rosenberg, Chuck Lacey, and myself, each put in $5,000 of our own money as the original bankroll to start what now is Roseman University, that has over $300 million in assets and an annual operating budget of over $100 million. From the three founders, which by the way, we weren't initially employed when we started, we were volunteering all of our time, but from the three co-founders, we now employ 262 folks in Nevada and 239 people in Utah. Our campuses sit on 43.4 acres of developed land with an additional 54.4 acres that we can develop for future initiatives and programs. And just so you kind of understand in terms of square footage from a real estate perspective, in terms of that finished space, we started with leased space of about 5,000 square feet in the Painters Union building here in Henderson. So those of you that are from Nevada may be familiar with that area of town. So 5,000 square feet. And that 5,000 square feet in 20 years has grown to 178,000, almost 179,000 square feet in Henderson, over 327,000 square feet in Summerlin, and over 244,000 square feet in South Jordan, for a total of over 750,000 square feet of building space that Roseman University occupies between all three of our campuses, or amongst all three of our campuses. As we said, we started with 36 students in the first class, and today we have more than 1,600 students enrolled and more than 6,000 alumni. And you can see some of them here in this picture, and I think they were doing an autism, these are some of our students that were doing an autism walk one year, so they volunteer back for the community as well. So those are some interesting stats and numbers, but I want to turn it at this point over to our colleagues at Trip Umbach. You know, for several years leading up to our 20th anniversary, we had talked about how we knew that we were having a very positive economic impact on the communities that we served. But to quantify that, we needed some experts to come in and help us out. And so with that, I want to introduce Paul Umbach and Julie Schmiel from Trip Umbach, who performed our economic impact study for us, and let them walk you all through the numbers and what it means to our communities from an economic standpoint. So Paul?
Thank you, Renee, very much. And congratulations to you and to Harry and to all the other folks in the Roseman family for the amazing things they've done in just 20 years. And I can't imagine what the next 20 years can bring with the success that you've had. And we thank you for giving us a chance to measure, Julie and I, the economic and social impact. We have about 1,000 healthcare and higher education clients in all 50 states and in 400 markets, and we've enjoyed our time working with you in Las Vegas and also in Utah. And we really have had the opportunity to measure not just your campuses and your economic impact of operations, which are impressive, but also the impact of your community and social and programs, your alumni, and so many other things. So let's get right to some of the numbers.
Ooh, why am I going backwards? Hang on.
There we go.
Oops.
Sorry. Just in 2019 alone, which is last year, you brought $143 million into the Nevada economy and employ over 1,206,000 people directly and indirectly. So if you remember from Renee's earlier slide, there's 250 or so full-time employees, but there's many additional, like 1,000 additional support jobs throughout the state that wouldn't be there if it wasn't for Roseman. And also, even though you're a nonprofit and you don't pay real estate property tax, you pay a lot of other taxes. And as Renee said, you do all this without taking money from the state, but you actually, through your operations, return $6.6 million in state and local tax revenue. And again, that's just for 2019. So that every year, there's that kind of impact going just to Nevada from the operations of the two campuses there. Next slide.
Okay, there we go.
There's also a big impact from the programs in South Jordan, Utah. About $115 million get brought into and generated through the state of Utah, and about 1,200 jobs are supported. And you can see that the Utah numbers and the Nevada numbers are significant. And this is really just the beginning of so much more growth that can happen over the next several years. So these annual numbers will continue to grow throughout the next decades. Next slide. So when you add it all up, it's about more than $250 million in annual impact, supporting 2,392 jobs, and also paying state and local tax revenue in these states. And that's really the tip of the iceberg. That's just the operations of Roseman University. When you go to the next slide, you'll see that there are many other things that are part of the impact. The $1.2 million in charitable donations, volunteer services, the fact that you operate dental clinics and other programs that are free or at low cost to the community. It's an amazing thing when you consider how many patients are encountered every year, and the students and faculty and staff, and how much they donate and give away. That's all in our report. Next slide. Was mentioned before was of the economic impact, the Cure for the Kids alone has a $43.4 million economic impact, supports about 285 jobs and $5 million in local tax revenue. And that's just the operations of this amazing St. Jude type program, and the only one of its kind in Nevada, and one of the few in the Mountain West that actually provides the care to children that without this program would have to go out of state, and that's not just those beautiful children there going out of state. It's all the caregivers, parents and grandparents that would have to disrupt their life to get those treatments. Now for the big numbers on Cure for the Kids. One more back. Almost $500 million in the economic value of those services. So when I mentioned what would happen if Nevada didn't have Cure for the Kids, $461 million every year in economic impact would be leaving the state, and 4,000 jobs are supported, and quite a lot of tax revenue. And what that says is that this economic value of this program is just amazing when you consider that folks are not able to, don't have to leave the state, but actually can get their state, their care in Nevada. A big impact, and it takes 20 years to get to these big numbers, if you move to the next slide, is the alumni impact. There is a great army now of 5,500 alumni, creating about $2.5 billion for the national economy. And those alumni directly and indirectly support about 30,000 jobs nationwide. One great thing about health science and the health science professions is the big numbers are just the starting point. The care that's given and the quality of care, the health impacts are not measured in our study. So really the big story is that people all over the United States and people all over the states of Utah and Nevada are healthier and have the support from nurses and other health professionals, pharmacists, dentists, and soon to be doctors, as we've been able to help with the development of the School of Medicine as it moves into its launch, and that medical school will have an amazing economic impact. The average medical school economic impact in America is several $100 million a year. So when that program's at full maturity, that will just add to the economic impact and the societal impact that you saw. We do have a report that will be available to people at this stage. We just wanted to give you a taste of some of the top numbers. I want to thank Julie Shamil and her team for putting this together. And Renee, congratulations again. Amazing impact in 20 years. And I congratulate you and pass it back to you.
Thank you, Paul, and thank you, Julie, for the work that you've done for us. And, you know, again, it was pretty eye-opening for me to see your report, recognizing that, again, this was based only on 1 year. And, you know, certainly over 20 years, if we start to add that up, I mean, obviously in the first few years, we didn't have the significant impact that we have 20 years later, but there's been an exponential growth. And thinking about how that can grow in the next 20 years, I'm really proud of what Roseman's been able to do in that arena. So thank you.
It's good that we're all young, because I will be back measuring in 30 years and then maybe even in 50 years your impact. So it'll be fun to stick around and see. And also the other thing I want to mention is that this really is just the beginning of the health impacts that we're just starting to understand, and the value of health to the economy. And so there's another whole public health side of this that's even more amazing.
So we'll sign you up, send me the contract, we'll get it signed, and we'll go from there. We also really wanted to point out that, you know, we couldn't have reached where we have in 20 years without our community partnerships. And we've added the logos here of just some of those folks that we've partnered with over the years. Our healthcare partners, which are wide and extensive and throughout both states. And we've also enjoyed some fun partnerships with some of our local sports teams. Vegas Golden Knights, if anybody's seen my office, you know that I'm a rabid fan and a little bit sick that we have to wait another 2 months for the next season to start up. Our local soccer team, the Las Vegas Lights, and the Utah Grizzlies hockey team. So we've had some great partnerships throughout, both on the sports side as well as our health partners, health community partners. So that's been a fairly rapid walk through the last 20 years, but I don't want to end this without talking about where are we going next. So I want to talk a little bit about our strategic plan, because the strategic plan is our guide star for at least the next 5 years of where Roseman wants to go. And one of my favorite sayings is, a failure to plan is a plan to fail. And Roseman is not in the business of failure. So we have a strategic plan that we've put forward that we believe captures the most significant components of where we want to go and what we want to do, who we want to be in the next 5 years. So just a little bit of background, the current strategic plan has resulted from a two-year-long process that created a platform for the university community, the Board of Trustees, to process and reflect on the institution's mission, fulfillment, its evolution, and critical market factors that shape higher education and healthcare landscapes today. And so as a result, we expanded our existing mission statement. So there are elements of our previous mission statement here, but we felt that the last 20 years of necessity to some degree have been inwardly focused as we've grown the university from that kernel of 3 individual co-founders at $15,000, 500 square feet in one program. And with that inward focus behind us, or still part of us, but part of what's behind us, we are looking now to the future and recognize that in our future is partnership and using those partnerships to expand and grow with our communities in a way that's collaborative. So with that, we modified our mission statement to what you see in front of you. Roseman University of Health Sciences advances the health and wellness of the communities we serve by educating current and future generations of health professionals, conducting research and providing patient care. We actively pursue partnerships and affiliation that are aligned with our mission. We work to create an environment that fosters both internal and external collaboration to achieve optimal outcomes, and are committed to responsible fiscal management in all of our endeavors. So with that as the starting point for our new strategic plan, we put that mission statement together and then we broke it up again. We disaggregated it, and because there were some key phrases that we felt really were the linchpins or the foundational elements that would be our guide star moving forward in the next 5 years. So those key phrases: educating current and future generations of health professionals, conducting research, providing patient care, partnerships and affiliations, fostering internal and external collaborations, and responsible fiscal management would be the pillars that create, that ground what we're going to do in the next 5 years. So with that, we developed 6 operational areas for our strategic plan. And you can see that they mirror those phrases that came out of our mission statement. Our strategic plan is designed to be flexible. You know, in this day and age, things change too rapidly for you to have a 5-year strategic plan that stays as is and isn't altered or changed in any way. And if you chose to not alter your strategic plan, you'd be left behind. So we developed a way to look at individual year strategic initiatives that follow our strategic plan, that follow those core areas of development, the operational areas, and create initiatives that are intended to go for about a year or so. Some of it might be a little longer, some might be a little bit shorter, but things that we can achieve with deliverable outcomes. And you see the 2021 strategic initiatives here before you. There are 12 of them. They included College of Medicine that you're going to hear a little bit more about in just a second, a College of Graduate Studies, fostering interprofessional education, developing our student pipelines, taking a deep dive into our College of Pharmacy and its operations, making sure that all of our faculty and staff are aware and can understand the Roseman 6-point mastery learning model. We'll be developing a dental clinic in conjunction with our partners at Cure for the Kids, as well as bringing up a Roseman Cafe, the Roseman Roadrunner Cafe in particular at the Cure for the Kids clinic, our partnership with Renown up in Northern Nevada, growing our research mission, creating a Center for Healthcare Innovation and Healthcare Education, and ensuring that we continue to maintain the institutional financial health that has allowed us to grow and expand as we have over the last 20 years. And this slide is meant to represent the fact that once we came up with these strategic initiatives, we did a double check on ourselves and make sure that everything funneled back to the original mission. So with our original mission statement at its core, the 6 operational areas surrounding that are derived from the mission. Each one of those 12 strategic initiatives touches at least one, most of them several, points of those operational areas that come back to our mission. So with that, I want to spend a little bit more time on what is one of our primary strategic initiatives for not only next year, but moving forward into the future. And with that, I want to introduce the Dean of our College of Medicine. Dr. Pedro Joe Greer, as he's known, is formerly Professor of Medicine and Founding Chair of Humanities, Health, and Society, and the Associate Dean for Community Engagement at Florida International University. And he spearheaded the nationally recognized Green Family Foundation Neighborhood Health Education Learning Program, which addressed social determinants of health. He is a 2009 Presidential Medal of Freedom awardee. He is the recipient of a 1993 MacArthur Foundation Genius Grant Fellow, and he's published more than 30 articles and book chapters and wrote Waking Up in America, which if any of you get a chance, it is on Amazon. I know, I've checked it out, I've read it. It is just a marvelous testament to Joe and his service to his community and how he grew up and how that has colored his life experiences. So plug for your book, and I'll only take 5% of the royalties as your new agent on that. But Joe has also spent time advising Presidents Bush Sr. and Clinton on healthcare policy, and he has been and is a trustee at the RAND Corporation, which many of you know as America's oldest and largest think tank. So Joe has been with us since about April of this year to spearhead the development of our College of Medicine and all that goes along with it. And I can't tell you how pleased we are that you're with us, Joe. And I'm going to turn it over to you so that you can talk a little bit more about our College of Medicine and some of the exciting things that are happening, the exciting people that you brought with us, with you to Roseman, and all good things College of Medicine. So I will turn things over to you.
Thank you, Renee. And I want everybody to know that my mother wrote that introduction. So the thrill that we have and the honor that we have to be part of the Roseman family is because of who Roseman is, its culture, its ethics, and its contribution to the community. And our mission is to align students, educators, and communities in designing and delivering an inclusive and collaborative environment for innovative learning, healthcare, and you're covering up my last little thing there. So you could read that.
Innovative learning, healthcare, and research.
And research. We came out here with a team from Miami, joining up with Roseman faculty to develop what we think is going to be the most innovative program in medical education, as medical education is rapidly changing in this country. And Roseman is the place to do it. Roseman is the place to do it as a health science university. It is the place to do it because of its collaborative culture. It is the place to do it because of the ethics of which we find in this institution. And we're really, really proud to be here. We want to be measured on the impact we have on the populations that we take care of. We want to improve the health of the state, both rurally and urban, and most importantly, increase the number of physicians in Nevada. With that, the importance of one of the strategic planning, which was the pipeline, to draw students here from the state, and in particular, the students that are underrepresented minorities. Our experience has been that these students have incredible capabilities, and we have shown in our past institution that you can have the highest pass rates of the steps in the entire state and the entire region. We want to produce the best clinicians, the most socially accountable clinicians, and those that are prepared to move in the rapidly changing world of medicine and its delivery. Next slide, please. And here is the part of the first part of our team. We have Dr. Luther Brewster. Lou and I have known each other now for about 14 years and worked together. And Lou was the main architect in developing the household-centered model of care that we're going to be instituting here by the name of Genesis, and you'll see that at the end. And that will be kicked off prior to the opening of the medical school. It's an interprofessional program that gives students experience in longitudinally taking care of households with household visits, at the same time taking care by identifying and mitigating the social determinants of health, which by literature and by our experience are 80 to 90% of the causes of disease in this country, but we don't address them. By addressing those, we can bring people back to resilience. Lou did his postdocs at the University of London in community development. He worked for John Lewis for many, many years. He was on faculty at the University of Michigan. I hired him after he was a founding faculty at the Florida International University School of Public Health, and also one of the founding faculties for FIU College of Medicine. He's also technologically brilliant and has developed a platform to follow the social determinants longitudinally. And hopefully by doing that here, we could use these as predictive analytics to look at when something happens socially, how will that affect your health? And we're going to be taking care of the most vulnerable populations that exist here in the region, both within the city of Las Vegas and in the rural areas. Actually, Lou is off to Pahrump this weekend for a health fair out there, representing Roseman. Next to him is Dr. Karen Fendel Esposito. She is our Senior Executive Dean for Academic and Student Affairs. Just a little background on Karen. I've also known Karen for over 10 years. She developed at our prior institution. She was the head of the Office of Medical Education and then the head of the Office of Student Affairs, bringing together an institution where 70% of the students there only got into our institution, yet they had the highest pass rates and scores in step ones and the highest match rates. Just to mention also, she's Phi Beta Kappa and Alpha Omega Alpha and a biochemist, just like Dr. Rosenberg. Bringing to us with both of these, and also she has worked also closely with AMI in Europe, both national and international recognition. Dr. Maren Gillis is our Senior Executive Dean for Faculty Affairs and Educational Innovation. She is the chair of the Cambridge Consortium for Bioethics. That's not Cambridge, Massachusetts, by the way. That's Cambridge in England. And she brings to us the background of a philosopher and a bioethicist leading the country in bioethics, as well as helping design things like studio design teaching to give more critical thinking skills for our students to be able to deal with the complexities that occur when they graduate. Next slide. We have Dr. Cheryl Brewster, who's our Senior Executive Dean for Diversity, Equity, and Inclusion. Cheryl is a renowned leader in this country in diversity and also in pipeline development. She is also putting together the Diversity Council at Roseman. And one of the things that attracted us to Roseman was just not the diversity of the students, but the diversity of the faculty at Roseman University, including the fact that it is led by you, Renee. So that to us became something very, very important. We also brought in from Roseman, Dr. Bruce Morgenstern, who's our Senior Executive Dean for Clinical Affairs, and the editor for the book on the guidelines for clerkships in medical education. He comes from the Mayo Clinic. He's brilliant, and we're thrilled to work with him. Tom Hunt, who is the Chair of Family Medicine and Associate Dean for Clinical Education, is one of the most remarkable individuals I have met. Now, apart from being a great clinician, because he's now my primary care doctor, so he's going to be taking care of me, he has put together the largest family medicine training program in the entire state of Nevada. And we look so forward to working with him. Apart from that, he and I both share our love for rock and roll. Next slide. Jamie Fairclough, who we also brought from Miami, is our Associate Dean for Assessment and Evaluation, because research is so important, and it's vitally important to start this off at the very beginning. Just to mention, she's the only one on our team that's a member of Mensa. So I can tell you right now that they have not only international, national, and regional acknowledgements, but they're brilliant. And so I think the highlight of being a dean is hiring people way smarter than you that can put this together and make it work. We are thrilled to work with Christina Conley, who used to work for Roseman University Central in finance, who is now our Senior Executive Dean for Finance and Operations. Apart from doing that just for the medical school, she also does that all for the Roseman Medical Group, which is one of the great assets that we have here. And I want to congratulate Tom and Bruce for the job they had done there. And now Dr. Proom, who is the new clinical director of the Roseman Medical Group, and we're thrilled to have her. We have Vicki, and Vicki is our special assistant to the dean, and Vicki is a renowned administrator here in the region in Las Vegas, and has been introducing us to the different hospital systems and the different groups that exist here. Because as we go forward, we want to be ecumenical. We want to work with everybody. We want to work and take care of the most vulnerable populations, those that are uninsured, those that are affected by COVID, those that are really going to need our help to get these families back to resilience so they can lead a normal life. Next slide, please. When you look at this here, these are the social determinants of health, originally called the social determinants of inequities. These are the different things that cause people to get sick. Your income. As a matter of fact, right now in the United States of America, the most important factor for your health outcomes, your morbidity and your mortality, has nothing to do with your genetic code, but it has all to do with your zip code. And we see that during COVID. We see the populations that are most adversely affected, the African Americans, and here in the southern region of Nevada, the Hispanic population. And those are the ones that we feel really need our help and where we can make the biggest impact. And this is going to be led by the project called Genesis, of who Lou is the chief architect of that, which we will be launching. This is household-centered care. Once again, identifying and mitigating the social determinants of health to allow people to get to resilience. What we have found out in our over collectively almost 100 years of care within communities is that the household becomes the most important measure, the smallest unit of measure, not just the individual. And when you go into the household, you measure the social determinants of health of the entire household and the individuals. Because if one individual loses a job there and it is the bread maker of that household, it affects the entire household. And if you take care of the household collectively, you can really go forward, including behavioral health interventions. And when you have a lot of these behavioral health and issues that are going on, and right now they're accelerating with COVID, when you can do the therapy at home and then take the time to educate the rest of the family, you now have a team that helps resolve these issues, because you can't resolve physical health issues until you resolve the behavioral health issues. And you can't resolve the behavioral health issues until you resolve the social determinants of health. What I want everybody to look at is, I want you to envision the impact that we can have, the future professionals that we will be producing together, the uniqueness of the program that we have, and the collaborations that we're going to have not only with the community, but right now we are collaborating with the RAND Corporation and looking at policy and racial justice and seeing how we do it, and they chose us to do that, as well as with Claremont McKinney KGI, the Keck Graduate Institute, as they're forming a new medical school. And we will be having a consortium of deans and medical schools with similar-minded missions that we have to be able to change medical education in this country. And I'm going to be extremely proud, because it's going to be Roseman that's going to be leading the country in this. Thank you. And thank you for the opportunity.
Thank you, Joe. And you and your team and getting the College of Medicine off the ground, starting Genesis here for Roseman is a real game changer in a lot of ways, not just for Roseman, but really, truly, as you mentioned, for our communities. We look forward to seeing the improved healthcare outcomes, the increase in the number of physicians here in Nevada, and as you said, the clear pipeline of folks from K through 12 through higher ed into the Roseman College of Medicine, so that we are in essence breeding our own from Nevada to stay in Nevada. And if you noticed Roseman in our pattern over the years, you'll see that we've started a program in one state and we've then duplicated it or replicated it in our neighboring state, whichever one that happens to be. So you saw us start pharmacy and extend that to Utah, nursing and extend it to Utah. We started dental in Utah. Look forward to someday seeing a dental program here in Nevada with Roseman University. And as our College of Medicine grows and matures, look forward to seeing a Roseman College of Medicine in the state of Utah as well. We look at ourselves truly as a regional university that impacts the education and healthcare of both of those communities that we serve. And we look to do well by doing good. And it's an important component to who we are. It is who we are. It's in our DNA. I do want to not leave our presentation without saying, for those of you that are interested in more information about our College of Medicine or about Roseman in general, we definitely invite you to come visit with us. We have so far, as I mentioned, we don't take any support from the state. We really need this community's support. You heard all of the numbers in terms of the impact that we have, economic impact that we have on our communities. We need this community's support back to help us get this College of Medicine off the ground and doing all of the great things that we intend to do with it, as well as with our other programs. So for those of you that are inclined to help us with that, you can contact Roseman University and our advancement unit or myself directly, and we will definitely get you hooked up there. But with that last plea, I want to thank all of you for your time and attention. I was looking at the number of participants, and thankfully it didn't go down during the presentation. Everybody hung on till the end, so we appreciate you staying with us during this little more than an hour. Again, special thanks to Paul Umbach and Julie Schmiel from Trip Umbach for all the great information and economic development impact work that they did for us. I want to thank Joe for your presentation as well. You and your team, again, super amazing, and we're so happy to have you with us. I want to thank Jason Roth for all the work that he did in putting all of this together in our PowerPoint and getting the word out and spreading the word for people to participate with us today. Vanessa Maniago, who did so much yeoman's work, not only on a lot of the background information, but also on the strategic plan itself. We have just so many people at Roseman. I could spend the next hour thanking all of the folks that have played a part and played a role in getting us here throughout this 20 years and where we're going to be in the next 20 years. But I think it's time to end. So I will just conclude by saying thank you to all, and I hope you all have a good evening. Bye-bye.
Bye-bye. Renee, thank you for your leadership.
Thank you.